It starts with a sharp sizzle of internal burning, followed by the maddening, constant urge to run to the bathroom, even with an empty bladder. Most people assume these symptoms are a minor, temporary inconvenience, a localized annoyance that will simply fade away with time. This is the onset of a urinary tract infection, or UTI. The condition involves a microscopic struggle across 3 distinct anatomical zones: the urethra, the bladder, and the kidneys. Ignoring these initial, painful alarms is the primary mistake that allows a highly treatable issue to escalate into a medical crisis. The primary culprit behind this invasion is a specific, well-known organism, the E. coli bacterium. E. coli is a native resident of the human body, living safely and predictably within the confines of the intestinal tract. This diagram shows the critical boundary between your digestive and urinary systems. An infection occurs when these native gut bacteria slip across that border into the urethra, a sterile environment where they cannot be tolerated. Every UTI represents a geographical failure. Native bacteria have colonized a part of the body where they do not belong. This bacterial invasion targets women at a significantly higher rate than men. To understand the disparity, look at this glowing measurement line. The female urethra is significantly shorter, creating a smaller physical gap. That shorter distance acts as a high-speed highway, allowing bacteria to reach the bladder before natural fluid cycles can flush them out. Once the bacteria colonize the bladder, the urine becomes cloudy or foul-smelling. The body reacts with pelvic pain and the passing of abnormally small amounts of fluid. These uncomfortable symptoms indicate that the body's first line of defense is currently losing ground against an exponentially multiplying threat. If the bladder infection is left untreated, the bacteria do not simply vanish. They begin an upward ascent. The pathogens migrate through the ureters, the narrow, muscular tubes that serve as the only bridge between the bladder and the kidneys. As the bacteria infiltrate the kidneys, the symptoms shift from localized discomfort to systemic distress, bringing on high fevers, bouts of severe vomiting, and deep, radiating back pain. Inside the kidney, the bacteria attack the delicate filtration units. If they penetrate these walls, as shown here, the pathogens spill into the renal blood vessels, entering the general circulation. A systemic infection in the blood, or sepsis, can rapidly shut down multiple organs, transforming a localized irritation into a life-threatening medical emergency. Halting this progression requires a professional diagnostic protocol, a urine test to confirm the infection, and a culture to identify the specific bacterial strain. Once the strain is identified, physicians use targeted antibiotics to neutralize the colony. You must avoid self-medicating with leftover pills or incorrect dosages, as this dangerous behavior rarely clears the infection. Using the wrong medication provides a training ground for the bacteria. They mutate and develop an impenetrable shield, a biological defense known as antibiotic resistance, that makes future infections much harder to treat. In specific cases, like pregnancy, the risk is even higher. Expectant mothers require immediate testing and treatment, even if they show no physical symptoms at all. Precise medical strikes are the only way to eradicate the invader without accidentally engineering a more resilient pathogen. Prevention remains the most effective strategy. This starts with high water intake to provide the mechanical force needed to flush the urinary tract. Behavioral defenses are equally vital. Never hold urine for long periods, maintain meticulous hygiene, and pass urine immediately after intercourse to clear the urethra. Finally, avoid tight, restrictive clothing that creates the warm, moisture-rich environment where bacteria thrive. Physical pain is a communication tool. Listening to those early signals and seeking professional care is the most effective way to protect your long-term health. Share this video to help others recognize the signs before an infection escalates. Follow our channel for more evidence-based health guidance.